So, the information that drove these studies to create this theory came from the work of Olshansky in 1962. Now, I said this earlier in the previous slide. This is important because it's good to remember that throughout time, things change. Back in the day, grief was previously conceptualized as a process that was supposed to resolve over time, and if it didn't, it was considered abnormal. But throughout the research of Burke, she determined and realized that this is actually a pervasive sadness that is permanent, can be periodic, and also progressive in nature. So they used the founding information of Olshansky for the idea of chronic sorrow and the emotion of chronic sorrow. And then the NCRCS focused on the response of grief and incorporated other work, in response to stress, and used the adaptation process for management methods to create their work. And then they also investigated like internal coping strategies as well as external coping strategies to identify the theory of chronic sorrow and make sure that it's known that it's not just a theoretical theory based on chronic sorrow, but it's also to include the experience of it as well as the coping response to the phenomenon of it. So, with the major concepts and definitions, like I said, there are four main topics, them being chronic sorrow, loss, trigger events, management methods. But under management methods, we obviously know that there are sometimes ineffective management and then also effective management. So, starting off with chronic sorrow, it's good to know that chronic sorrow is an ongoing disparity resulting from a loss characterized by pervasiveness and permanence. Symptoms of grief recur periodically, and these symptoms are potentially progressive. Now, the empirical evidence that came from the chronic sorrow actually originated from the work with the spina bifida patients from Burke. But with the inclusion of the other two young ladies, as I said in the previous slide, they all focus on different parts and different research to try to create this massive theory that it would help more patients for the greater good. And then based on that study, they did come up with information that helped to define and refine the definition of chronic sorrow as the periodic reoccurrence of permanent pervasive sadness and other grief-related feelings associated with the ongoing disparity resulting from a loss experience. So that's another way of just restating what I said earlier. The next topic is loss. Now this occurs as a result of disparity between the ideal and real situations that happen in life. So for example, there is a quote unquote perfect child, and then there's a child with a chronic condition who differs from that ideal perfect child. So there's the wishful thinking and idea of what you want, and then there's the real life situation of what you have. The next one are trigger events, which of course are situations, circumstances, and conditions that highlight the disparity or the recurrent loss and initiate or exacerbate feelings of grief. Now, trigger events. These are things that precipitated or came before the loss of grief. So these would be situations like anniversaries or just comparisons to what you would normally do maybe around the holidays or something like that, that would remind you of the loss that you have. And they found, the NCRCS group found that family and caregivers and persons with chronic conditions usually experience triggering with management crisis. Okay, so that could be unending caregiving that someone may have to do for someone else, and then boom, you're triggered again. Or also just a role changing of who you are, and then having a memory sometimes can also be a triggering event. The last one is management methods. So management methods are means by which individuals deal with chronic sorrow. This could be internal or external factors. So the NCRCS designated internal coping strategies in 4 different ways. There's action, cognitive, interpersonal, and emotional. So internal strategies would be personal coping strategies. For example, with action coping mechanisms, They're usually used across all subjects um, with chronic conditions and their caregivers. So that would be something like keeping busy or doing something for fun. And that's an action oriented way of coping with the stress of what you're dealing with. Um, Cognitive coping was frequently used as well, and that's thinking positively, making the most of the situation, not trying to fight what's happening to you. Then there's interpersonal coping examples that include going to a psychiatrist, joining a support group, and talking to others. And then, which kind of, for me, it crossed the line a little bit with external management, but it's not the same. So now I'll talk about external management last. There's emotional strategy, which includes examples of like having a good cry, releasing those emotions, expressing your emotions. So all of these are management strategies that were labeled effective when a subject used it to describe their grief or decrease their feelings of re-grief. So after a triggering event, something of that nature. And those were personal coping strategies. Then there's also external coping strategies, and that could be healthcare practitioner or other person's intervention, so interventions from other people. And at first it was described specifically for healthcare professionals, but they did expand it. Um, but usually it's just through the roles of empathetic presence, teacher expert, caring, and competent professionals. Um, then there are the ineffective management and then effective management, which most likely we would want it to be an effective management, which results from strategies that lead to increased comfort of the affected individual. So for example, like I said, those for the examples that I gave for the internal coping strategies, to help relieve stress and feelings of re-grief, that would be an effective management process. That's what the goal would be. And then there's ineffective management that results from strategies that increase the individual's discomfort or heighten the feelings of sorrow. So you're using something to cope with the issue that you're dealing with, and it's not really relieving the pressure. It's not really helping you work through it. That would be ineffective management. And these are effective and ineffective management are just subgroups of the management methods, but this concludes the four main concepts that are included in this theory of chronic sorrow.